Most of us grow up hearing that vegetables are the healthiest foods on the planet, and that's mostly true. But here's something surprising. For older adults, especially those over 65, not every vegetable is as harmless as it seems. In fact, some can pose unexpected health risks when combined with aging bodies, medications, or chronic conditions. Today, we explore 5 vegetables that, when eaten the wrong way, might do more harm than good. 1. Spinach, a silent risk for those on blood thinners and kidney trouble. Spinach. It's one of those leafy greens that nutritionists and doctors alike often champion for its dense vitamin content. Rich in iron, vitamin K, folate, and fiber, spinach has built a reputation as one of the healthiest vegetables around. But hidden beneath its lush green leaves is a nutritional complexity that makes it potentially dangerous, especially for older adults on specific medications or with chronic conditions. Let's step into a quiet kitchen where a woman named Margaret, age 72, prepares her breakfast smoothie. She adds bananas, a handful of berries, and her usual handful of raw spinach. It's her routine. She believes it's helping her stay strong. But what Margaret doesn't know is that this daily habit is quietly interfering with her blood-thinning medication warfarin. Here's why that matters. Spinach is extremely high in vitamin K. This vitamin plays a crucial role in blood clotting. For most people, that's a good thing. But for those on anticoagulant medications like warfarin or Coumadin, which are prescribed to prevent dangerous clots, high levels of vitamin K can work against the medication. It's not that spinach is inherently bad, it's that it can throw off the delicate balance needed for those medications to be effective. One day your blood is too thin. The next, it's not thin enough. And that seesaw can lead to serious complications like internal bleeding or stroke. Now, let's shift to another story. This time it's Joseph, a retired teacher who's been managing chronic kidney disease for years. His doctor advises him to limit foods high in oxalates, but Joseph, thinking spinach is a healthy choice, adds it to soups, sandwiches, and sides without a second thought. What he doesn't realize is that spinach has one of the highest oxalate concentrations of any vegetable. Oxalates bind with calcium in the body, forming crystals that can lead to kidney stones. For those with compromised kidney function, that's a serious issue. Even worse, if kidney function is already diminished, the body has a harder time filtering these compounds out. The result? A higher risk of stone formation, inflammation, and worsening kidney health. Spinach, like all foods, exists on a spectrum. It can be incredibly beneficial or quietly harmful depending on the context. So what can older adults do? If you're on a blood thinner, the key isn't necessarily to eliminate spinach altogether, but to be consistent. Let your doctor know how often you consume it so they can adjust your medication accordingly. And if you're living with kidney issues, ask your healthcare provider whether you should limit or avoid high oxalate vegetables like spinach, beet greens, and Swiss chard. Cooking methods matter too. Boiling spinach can reduce its oxalate content significantly, more than 80% in some studies. So if spinach is something you truly love, this may be a safer way to enjoy it. Finally, remember that a superfood isn't super for everyone. Our bodies change as we age. What was once helpful at 40 can become harmful at 70 if we're not mindful. It's not about fearing food, it's about understanding how food works with our bodies now, not just how it did in the past. The next time you're reaching for those dark green leaves, ask yourself, is this still what my body needs? Coming up in part 2, a seemingly innocent root vegetable that can spell trouble for those with blood sugar sensitivity and hidden heart issues. Stay tuned. 2. Beets, a colorful root with hidden challenges for the heart and blood sugar. They're vibrant. They're earthy. And for many, they taste like a sweet connection to nature. Beets, whether roasted, juiced, or blended into a salad, have become something of a wellness darling. Rich in nitrates, antioxidants, and fiber, they're often credited with improving blood flow, lowering blood pressure, and supporting liver function. But for older adults, especially those managing cardiovascular conditions, diabetes, or digestive sensitivity, beets can quietly complicate what seems like a simple health routine. Let's begin with something surprising: blood pressure. Yes, beets are known to help lower blood pressure thanks to their naturally occurring nitrates. When consumed, these nitrates convert into nitric oxide, which relaxes blood vessels and improves circulation. This is often celebrated as a heart-healthy benefit, and it can be if you're starting with high blood pressure. But for some older adults, especially those already on blood pressure medications, this can lead to a problem known as hypotension when your blood pressure dips too low. Picture this: Barbara, a 74-year-old with a long history of hypertension, finally has her numbers under control thanks to a carefully managed medication plan. She's thrilled. Wanting to be proactive, she starts drinking beet juice every morning, thinking it will further support her heart health. But within days, she begins to feel dizzy when standing, lightheaded in the mornings, and occasionally disoriented. What's happening? The combination of her medication and the natural nitrate load from beets is working too well. Her blood pressure, instead of stabilizing, is now dipping below safe levels. For someone younger, that might just be annoying. For someone in their 70s or 80s, it could be dangerous. Fainting, falls, confusion, these are not minor issues. Then there's blood sugar. Beets, while not as high on the glycemic index as some other root vegetables, do contain a significant amount of natural sugar. In one medium-sized beet, there are about 6 to 9 grams of sugar. That may not sound like much until it's part of a juice blend, a salad, a soup, and a roasted side all in one day. For older adults managing type 2 diabetes or insulin resistance, the cumulative sugar content from beets can cause subtle spikes in blood glucose, especially when beets are consumed without enough fiber or protein to slow digestion. What's more, juicing beets, a popular trend, removes most of their fiber, making the sugar hit your bloodstream even faster. And here's another concern that often flies under the radar: bituria. That's the term for when your urine turns pink or red after eating beets. While it's not dangerous on its own, it can mask signs of real medical problems, like blood in the urine or gastrointestinal bleeding. For seniors already managing complex health issues, this kind of confusion can delay critical diagnoses. So what's the takeaway? Beets are not bad, but they are potent. And as with all potent things, they require thoughtfulness. If you're drinking beet juice, do it in small amounts and not daily, especially if you're on heart medications or prone to low blood pressure. If you're eating beets, pair them with protein and fiber to slow down the sugar absorption. And most importantly, talk to your doctor or nutritionist about how often you're including them in your meals, particularly if you're managing a cardiac condition, diabetes, or dizziness. For older adults, even something as bright and cheerful as a beet can have two sides: a nourishing helper or a hidden risk. The difference is in how well we listen to our bodies, how open we are with our doctors, and how willing we are to adjust long-held food habits for the sake of long-term wellness. In the end, it's not about avoiding foods. It's about building a new relationship with them, one grounded in the needs of today, not yesterday. Up next in point 3, a common household staple found in nearly every stew or stir-fry, but it may be quietly worsening inflammation and bloating in older digestive systems. You might be surprised to hear what it is. 3. Onions, the digestive disruptor that often goes unnoticed. You sauté them. You caramelize them. You fold them into casseroles, soups, and sauces. Onions are so deeply woven into the fabric of cooking that we rarely think twice about them. Their savory flavor builds the base of countless meals, and for many, they're seen as a must-have. But for older adults, particularly those with sensitive stomachs, acid reflux, or irritable digestion, onions can be a surprisingly troublesome addition to the plate. Let's begin with the story of Arthur. Arthur is 76, and cooking has always been his joy. He doesn't make elaborate meals anymore, but his go-to comfort is a big pot of stew simmering on the stove. Always with onions, lots of them. Over time, though, he notices something. After each meal, he feels bloated. He has heartburn that wakes him at night. His stomach gurgles in uncomfortable ways. At first, he blames age, then stress. But eventually, after seeing a nutritionist, he learns something that shocks him. The onions may be the culprit. How can something so simple cause so much discomfort? Here's the science behind it. Onions, especially raw ones, are high in compounds called fructans. Fructans are a type of fermentable carbohydrate that fall under the category of FODMAPs, fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. These are short-chain carbs that can be difficult for the small intestine to digest, especially in aging bodies where gut enzyme production may be slower and more limited. When these compounds aren't properly digested, they ferment in the gut, producing gas, bloating, and in many cases, abdominal pain. This can feel like general indigestion, or for those with conditions like irritable bowel syndrome, IBS, or gastroesophageal reflux disease, GERD, very common in older adults, it can flare up into something much more disruptive. You might not think twice about those onions chopped into your salad or sautéed into your omelet, but your gut may be reacting with full alarm. And here's something else worth knowing. Onions don't have to be raw to cause problems. Cooked onions, though somewhat gentler, can still retain enough of these fermentable compounds to cause issues in sensitive systems. Then there's acid reflux, a quiet antagonist in many seniors' lives. Onions are one of the top-known dietary triggers for acid reflux, especially when eaten close to bedtime. They relax the lower esophageal sphincter, the muscle that prevents stomach acid from rising into the esophagus. For someone already experiencing nighttime reflux, a seemingly harmless onion-rich dinner can result in hours of disrupted sleep and morning discomfort. So what's the alternative? Does this mean giving up onions completely? Not necessarily. It means personalizing your plate. If onions are causing digestive distress, try infusing flavor instead of eating the pieces themselves. For instance, sauté onions in olive oil and remove them before cooking the rest of your dish. This leaves behind the rich aroma and depth without the problematic compounds. You can also experiment with scallions or chives, which may be gentler on sensitive stomachs, especially the green tops. Another helpful approach is to reduce quantity and frequency. Onions may not cause issues once in a while, but eating them daily, especially in raw or heavily cooked forms, can build up discomfort over time. If you're someone who struggles with bloating, reflux, or unpredictable digestive patterns, keeping a food journal may help you identify if onions, or other high FODMAP foods, are contributing to your discomfort. Sometimes it's not about eliminating a food entirely, but understanding your body's limits and adapting accordingly. In the twilight of life, comfort isn't just about a cozy chair or a warm blanket. It's about digestive ease, gentle nourishment, and the freedom to enjoy your meals without consequence. And that begins with awareness, knowing what foods work for your body and what foods quietly work against it. So the next time you reach for that onion, pause. Ask yourself how your body usually feels afterward. You may find that the answer isn't in cutting things out completely, but in cutting back, listening more closely, and treating your digestion with the respect it's earned over decades. Coming up in point 4, a vegetable that seems humble and hearty, but for those with arthritis, joint pain, or inflammation, it may be fanning the flames instead of putting them out. 4. Potatoes, a comforting classic that can quietly stoke inflammation. It's hard to imagine a kitchen without potatoes. Mashed, baked, roasted, or fried, they are the backbone of many traditional meals. In times of hardship, they fill plates with warmth and belly-filling satisfaction. For many older adults, potatoes carry memories of home-cooked dinners, family gatherings, and simpler times. But what if this beloved comfort food is also silently contributing to the very aches, stiffness, and flare-ups that make daily life harder as we age? Let's meet Frank. Frank is 79, a retired bus driver who lives alone and finds solace in routine. Most nights, his dinner plate looks the same: a small piece of meat, a scoop of vegetables, and a hearty portion of potatoes. He doesn't think much about it. After all, he's eaten this way for decades. But lately, his knees ache more in the morning. His hands are stiff when he wakes. And he's noticing that on certain days, when he eats more of those comforting mashed potatoes, the pain seems to whisper louder. So what's really happening? Potatoes belong to a family of vegetables called nightshades, a group that also includes tomatoes, eggplants, and peppers. For some people, especially older adults with osteoarthritis, rheumatoid arthritis, or chronic joint inflammation, nightshades can act like a spark in dry grass. They contain compounds called alkaloids, specifically solanine in potatoes, that have been linked to inflammatory responses in sensitive individuals. Here's what the research suggests. While not everyone reacts negatively to nightshades, those who are sensitive may experience a flare-up of inflammation after consuming them. That can look like increased joint stiffness, muscle aches, or even digestive upset. It's not immediate and it's not always easy to trace. That's what makes it so hard to detect, especially when the culprit is as common and comforting as the humble potato. And the problem doesn't stop at joint pain. White potatoes are also high in starch, which means they're quickly converted to glucose in the bloodstream. This can lead to blood sugar spikes, especially when eaten alone or in large portions. Over time, for older adults managing insulin resistance, prediabetes, or type 2 diabetes, this quick rise and fall in blood sugar can contribute to a roller coaster of energy, increased inflammation, and even weight gain, particularly in the abdominal area, where excess fat can further strain joints and organs. Now, to be clear, potatoes are not evil. They contain important nutrients like potassium, vitamin C, and B6. But it's their glycemic load, preparation method, and individual sensitivity to nightshades that determine whether they nourish or inflame. So what should older adults do? First, pay attention. If you notice more stiffness or pain after meals heavy in potatoes or other nightshades, consider keeping a symptom diary for a week or two. Track what you eat and how your body feels afterward. Sometimes the pattern is subtle, but once you see it, it's hard to ignore. Second, try a rotation diet. Remove potatoes and other nightshades from your meals for 10 to 14 days and see if symptoms ease. Then slowly reintroduce them one at a time. If you notice a return of inflammation or joint pain, you've likely found a trigger. Third, explore alternative root vegetables. Swap mashed potatoes for mashed cauliflower, roasted sweet potatoes, or steamed turnips. These offer similar texture and comfort but come without the inflammatory compounds. Sweet potatoes, in particular, are lower on the glycemic index and packed with beta-carotene and fiber, making them a better choice for blood sugar regulation and anti-inflammatory support. Finally, mind your preparation. Deep-fried potatoes, like French fries or chips, aren't just starchy, they're also soaked in inflammatory oils that can exacerbate joint pain and weight gain. Baking or steaming your vegetables and seasoning them with anti-inflammatory herbs like turmeric, ginger, or rosemary can offer flavor and relief. For those who have loved potatoes for a lifetime, it can feel daunting to reconsider them. But aging is not about restriction, it's about adaptation. It's about understanding your body's new needs and honoring them with care, curiosity, and respect. Comfort food should comfort the whole body, not just the taste buds. Coming up next in point 5, a crunchy, bitter vegetable often praised for its detoxifying power, but for those with thyroid issues, it may be working against you more than you know. 5. Kale. A detox darling that may disrupt thyroid function. If there were a poster child for modern healthy eating, kale would be it. It's dark, leafy, loaded with vitamins A, C, and K, and full of fiber, antioxidants, and even a bit of protein. Kale shows up in smoothies, salads, soups, and even baked as chips. For years now, it's been at the center of countless health campaigns. And in many ways, it deserves its praise. But there's another side to kale. One that becomes more important the older we get, especially for those with underlying thyroid issues, which are increasingly common with age. To understand the full story, let's meet Helen. Helen is 68, active, vibrant, and deeply committed to staying healthy. She starts every day with a green smoothie, usually blending kale, celery, cucumber, and lemon. She's proud of it. But recently, Helen's been feeling more sluggish than usual. She's cold all the time, her energy has dipped, and she's started to gain weight despite eating clean and exercising regularly. Her doctor runs tests and discovers something surprising. Her thyroid levels are off. What Helen didn't know is that raw kale, when consumed in large amounts and frequently, can suppress thyroid function in people who are already vulnerable. Here's why. Kale, along with other cruciferous vegetables like broccoli, cabbage, and Brussels sprouts, contains compounds called goitrogens. Goitrogens can interfere with the thyroid gland's ability to absorb iodine, which is essential for producing thyroid hormones. When the thyroid can't get enough iodine, it may begin to slow down, leading to symptoms of hypothyroidism, fatigue, weight gain, cold sensitivity, thinning hair, and mental fog. Now, for most people, eating kale in moderate amounts, especially if cooked, isn't going to cause any issues. But for older adults who already have low thyroid function, a family history of thyroid disease, or who are iodine deficient, these compounds can tip the balance in the wrong direction. And it's not just about how much kale you eat, it's how you prepare it. Raw kale contains more goitrogens than cooked. Blending it into smoothies or juicing it intensifies the exposure because it bypasses your digestion and delivers those compounds directly into your system in a more concentrated form. Cooking kale, through steaming, sautéing, or roasting, significantly reduces its goitrogenic effect by breaking down those compounds before they can interfere with thyroid function. So what's the takeaway? If you're someone who loves kale and has no thyroid issues, enjoy it, but aim for balance. Rotate it with other leafy greens like spinach, romaine, or arugula. Don't rely on it as the only vegetable in your daily routine. But if you've ever been told you have an underactive thyroid, are on thyroid medication, or have experienced symptoms like unexplained weight gain, fatigue, or cold hands and feet, it's worth being more cautious. Here are a few simple steps you can take. Cook your kale instead of eating it raw. Steaming or sautéing reduces goitrogens and makes it easier to digest. Don't overdo it. A few servings a week is plenty. Daily large portions, especially in juices or smoothies, can be too much. Vary your greens. Each leafy vegetable offers different benefits. Rotate with chard, beet greens, bok choy, or lettuce. Watch for symptoms. If you notice fatigue, brain fog, or changes in weight or mood, bring it up with your doctor. Ensure enough iodine. If your diet is low in iodine, consider adding iodine-rich foods like seaweed, eggs, or dairy, if tolerated. Always consult your physician before supplementing. Kale isn't the enemy, but it is a strong food, powerful, dense, and complex. And as with all powerful things, it requires thoughtful use, especially as our bodies evolve with age. In your younger years, your body may have adapted easily to new food trends or high nutrient loads. But in your later years, digestion slows, hormones shift, and organs become more sensitive. Foods that once healed can now harm if not adapted to your present biology. The key is not to fear food, but to listen. To trust that your body, with its decades of wisdom, is constantly communicating what it needs and what it no longer does. Because food is not just fuel. It's a conversation. And as you step into each new season of life, that conversation changes. If you found this helpful, don't forget to like this video and subscribe to My Reboot for more empowering, age-wise health content that meets you where you are, mind, body, and spirit.